Hello, this is Dr. Grande. Today's question is, what is misophonia? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, when we talk about misophonia, we're talking about a condition, not a mental disorder or any other type of disorder. It's something that's being studied, but has not yet been classified. And it's an aversive reaction to repetitive or pattern-based sounds. Sometimes it's referred to as selective sound sensitivity syndrome, and sometimes it's also referred to as sound rage. So with certain sounds, there would be a reaction with misophonia, and this reaction would be autonomic arousal and a number of distressing feelings, including anxiety, disgust, anger, or irritability. We could also see behavioral reactions with this as well, including avoidance or acting out on the feelings of anger. Now, there are triggers associated with this, and of course we know that they're sounds and they tend to be pattern-based. There's some debate as to what types of sounds would qualify under misophonia. So with one school of thought, the sounds have to be really directly related to the human body, like breathing or chewing. And with another theory, they could be any type of repetitive or pattern-based sound. So some examples would include typing, whistling, foot tapping or finger tapping, a clock ticking, an engine running or the sound of cars in the distance, stepping sounds, or something like opening a plastic wrapper. There's also a debate over what types of reactions emotionally an individual would have if they had misophonia. One school of thought is to qualify as misophonia, the reaction would have to involve anger, and the other school of thought has a wider range of emotions available, including anxiety and disgust, as I mentioned before. Now, when we talk about these triggering sounds, it's also important to remember that the reaction is not necessarily proportional to the volume or the intensity of the sound. So loud sounds wouldn't necessarily cause a greater reaction or trigger reaction as opposed to lower volume sounds. So as I indicated, misophonia is not an official disorder of any type right now. It's not a mental disorder, for example, that we would see in the diagnostic and statistical manual. And in fact, it may be a symptom of another disorder or a symptom of other disorders. We don't know if it really should be a distinct classification unto itself. We know that misophonia tends to be comorbid with a number of other conditions and disorders, including Tourette syndrome, obsessive-compulsive disorder, obsessive-compulsive personality disorder, a number of anxiety disorders, and tinnitus, which is ringing in the ears. Now, in terms of the treatment of misophonia, we really don't know a lot here. This is not a distinct classification. We don't know if it will be an official mental disorder at some point or some other type of disorder, and there's not a lot of research on how to effectively treat it. Again, we don't know if it's a symptom of something else or if it's really something that should be a primary diagnosis if at some point it becomes a disorder. So there is no established treatment protocol for misophonia, although certain treatments have been attempted and there are mixed results. There's some indication that cognitive behavioral therapy may be somewhat effective in treating misophonia, and there's also some research that indicates that exposure and response prevention may help a little bit. Some theories about treatment approaches have focused more on related symptoms to misophonia, like avoidance, anxiety, and anger. And of course, there are a number of treatment protocols already established for those feelings or behaviors. So misophonia is an interesting condition. We don't know a lot about it yet, but we do know it tends to affect a number of people and is probably underreported at this point. Usually, if a disorder is classified, we'd expect to see more reports of that disorder. If it's unclassified and not an official diagnosis, it's understandable why some people would not report the symptoms. So as research continues, we'll see how it fits in with psychopathology and what type of treatment options will become available. I hope you found this description of misophonia to be interesting. Thanks for watching.